Hello, my name is Dr. Shane Martin. I work with the Total Health Nutritional Center, and I'm doing a video on applied kinesiology, which is a system of medicine that I practice. Hello, my name is Dr. Shane Martin. I'm a doctor of chiropractic medicine, and I specialize in applied kinesiology. Now, part of my background, I was born and raised over in the Philippines. My parents were tribal missionaries over there, and my mom still works in a village clinic over in the jungles in the Philippines. Now, originally, for myself, I was bound to practice pharmaceutical medicine, and I came across a doctor who practiced applied kinesiology, and he was able to figure out exactly what was wrong with me, something that had stumped other medical doctors for years. And so I realized if I really wanted to make a difference and practice medicine ethically, then this is the type of medicine I had to practice. So from my educational background, I went to University of Wisconsin, finished my bachelor's in biology, then spent 4 years in a chiropractic school in Illinois, National University of Health Science, and got my doctorate in chiropractic medicine down there. And so currently, I'm practicing applied kinesiology and other types of medicine too. And the goal is to provide people with an alternative to pharmaceutical medicine for internal medicine, for infections, obviously for physical problems as well. So some of the objectives of this video is simply to help patients understand applied kinesiology and what to expect on a visit at Mission Clinic. So what we try to do is, with applied kinesiology, it's a fantastic diagnostic system. In fact, it's what got me involved in natural medicine when I was going down the pharmaceutical route. Part of my story is I was going to study pharmaceutical medicine, ran into a doctor of applied kinesiology, and he diagnosed me within 5 minutes of something that most the medical doctors I'd seen for all my life hadn't been able to figure out. So I realized at this point, if I really want to study medicine and get people better and quickly, then this is the type of medicine I need to practice. So it's probably best to begin with a theory of disease. There's so many different theories of disease. There's the genetic theory, there's the germ theory, and they all have a part to play in it. Now, um, how we treat disease is we look at stress. We look at chemical stress, maybe food you're eating, maybe or emotional stress. You may have had a bad day or bad relationships, what have you, or even just trauma from your youth or structural stress. Maybe you just have some lower back pain or migraine or what have you. So what our job is to figure out what the stress is, would be chemical, emotional, and structural, and to fix it. And once you balance the stressors in the body, then that'll take care of disease. Whereas if there's an imbalance, an overt imbalance in any of these stressors in the body, it will cause dis-ease or disease. Now, one of the hallmarks of applied kinesiology is using muscle testing for diagnostics, or it's a way in which a doctor can ask the patient's body questions. So it's a diagnostic system developed in the 1960s by Dr. George Goodhart. In fact, it was so effective that Dr. George Goodhart became the first chiropractic doctor to be invited to serve in the Olympics as a physician. And this is the type of medicine that I've been inspired to not only practice but also to teach. Now, with the diagnostic system of applied kinesiology, it takes some of the best of both worlds. It takes the disciplines of acupuncture, osteopathy, obviously chiropractic, naturopathy, herbology, homeopathy, all these incredible systems of natural medicine, and streamlines them and how it lets them to overlap, and then we use it to figure things out. So with muscle testing, the way I explain to my patients is if I were to expose a vial of rat poison to a patient's body, it deals with frequencies, and the nervous system would actually pick up on the frequencies of that vial of rat poison. And the nervous system would interpret it as a poison and would weaken, therefore, the muscles would weaken. Now, if I were to take a dehydrated patient and expose a vial of water to their body, the nervous system would pick up on the frequencies and interpret it as a solution. It's something that they want. And the nervous system would strengthen and the muscles would also strengthen. And so using these principles, we can expose the body to different things and figure out what's the solution and what's the poison. Now, in terms of research, muscle testing or applied kinesiology, it deals with working hypotheses. So it actually takes quite a bit of money, millions of dollars, and lots of research to actually turn it into an accepted theory. And unless you're selling a pharmaceutical or something that's going to make someone a lot of money, no one's going to really invest that sort of money into this type of research. And there is research out there. You can go on PubMed and look up applied kinesiology, and there's multiple uh, research papers that are written on this type of diagnostics. So one of the incredible things with applied kinesiology and muscle testing and so forth, you can actually figure out where the malpositions are in the bones and the joints and the musculoskeletal system. So typically, doctors will use X-rays or MRIs, and they're very, very important. But for basic problems, like let's say a malposition in the knee or the ankle, you can use applied kinesiology to figure out exactly which bone is malpositioned and exactly which way it needs to go. I had one patient who he was from France, and his doctors told him he needed to have knee replacements. And so using applied kinesiology, we figured out some of the bones were malpositioned and there's some muscles that need to be strengthened neurologically. Within 5 minutes, he was fine. He certainly didn't need any surgery for his knees afterwards. So using applied kinesiology, I can also ask the body questions about specific viscera, about the gallbladder, the liver, the stomach, the lungs, the heart, the blood vessels, and we can test to see if any system is subfunctional. And then once we get into the game that way, we can figure out nutritionally what's going on and how does the tissue need to be fixed. Now, pharmaceutical medicine is fantastic when it comes to emergency medicine. But apart from emergency medicine, I stay clear of pharmaceutical medicine. Drugs and pharmaceuticals will not fix any underlying issue, and any medical doctor who's honest will tell you the same. What it does is it masks symptoms. So by using applied kinesiology, you can tell, let's say for instance, is there a problem with the lung? And specifically, is there a infection? Is there an autoimmune response? Or does the lung simply need to be supported nutritionally, and specifically what nutrients do the lungs need, for instance? So as I mentioned, with applied kinesiology, what we typically use is food. Food was meant to be our medicine for our bodies. So we use supplements to support certain systems. So for instance, if there's an autoimmune response to the heart, which can cause sleep apnea, then there's a product called cardiotrophin PMG that I typically give to patients. And it gets rid of the autoimmune response in the heart, which usually comes from a nutritional issue, and that then the heart is repaired and the sleep can be restored. Also, I use lots of herbs, specifically for any antimicrobials, any infections. So I see a lot of patients with parasitic or bacterial infections, and if you can find the right herb using applied kinesiology, you can fix that fairly quickly. And also we use homeopathy, which is a fantastic system of medicine. In fact, it's the largest system of medicine. It was the second largest system of medicine in the world. Uh, and typically they use it in Europe, also in Mexico, and in India. It's very safe. You can use it with newborns, with infants, with the elderly, even with pets, and it does not interact with any medications. Now, another part of applied kinesiology is called vial testing. So I explained it to you a little bit before. We use homeopathic vials, and we can figure out if there's too much or too little of something. So, for instance, we can figure out if there's any hormonal imbalances, any infections, candida, bacterial problems, or parasitic problems, any heavy metals. We can even check if there's any anemia, any blood sugar imbalances, any food allergies, any biofilms. And we can do all of this very inexpensively, so you're not having to spend lots of money on blood tests. Now, vial testing is not clinically diagnostic per se, but clinically I find it to do an excellent job. In fact, I had one patient who had significant lesions all over his body, and he went to one of the top dermatologists in Wisconsin, and he was told he had a problem with his immune system. And so he came to me, and we used the vial test, and we figured out it was a parasitic infection. And with 2 weeks, these lesions that were just all over his body were gone. So one of the tools that we use for dealing with emotional stress is called Bach flower remedies. It's homeopathic, and what it does is it helps remove subconscious limiting beliefs. We also use homeopathy to take the edge off of grief or emotional stress, or use something called neuro-emotional technique. And we also use also manage the chakras in the body. Now, chakras overlap with neural complexes. So there's about 7 group areas in the body where nerves tend to congregate. They cause a higher frequency, or there's more of electromagnetic frequency in those specific areas. And if there's an imbalance in the flow of energy in the body through the nervous system, then that can cause emotional problems as well. So although chakras are usually associated with spirituality or New Age, you're really dealing with the anatomy and the nervous system of the body. Another fascinating system of medicine we use is called iridology. So back in the day, in the ancient times, shepherds would actually look into the eyes of their sheep or their goats to see if they're any disease. And since then, we've developed this system to something much more specific. So there are nerve endings in the eye itself, and so by taking pictures of the eye and analyzing them, you can actually see different systems represented in the eye. You can see the liver, the nervous system, the brain, the lungs, the heart, the intestines, the stomach, the liver, so on and so forth. You can see all the systems of the body represented in the iris, in the colored part of the eye. And you can tell if the tissue needs any support, or if there's any subfunctional issues or problems with those specific viscera. And so far, clinically, it's been absolutely amazing. So we also do blood work as needed. There's hundreds of panels we can do. I find that the vial testing is much more obviously inexpensive and extremely effective, so that's usually what I go to. But we can do genetic testing if we need to. We can do, there's a basic wellness panel, which covers over about 11 different panels or tests. I only charge $89 for that. You can do CBCs, Just the basic tests that you have done in any physician's office. And I find it to be very effective, and we make sure the costs are very affordable as well. Well, I hope this has been helpful to you. Thank you for watching, and when you see me in the office, just use the coupon code SEMINAR and we'll give you $10 off your first visits. And if you have any questions, go ahead and contact me and I will respond to you promptly.